Well, good morning, everyone. It's a pleasure to be here and to really kick off what is going to be a very exciting day with a lineup of some terrific speakers on obviously a very important topic and a topic that's become very relevant to the city of Chicago. And I think rightly so, they should be proud of how they're situated and their involvement in this new initiative that I'm going to describe to you. If I can have the first slide up. And I was asked to really help lay the foundation for what's going to be discussed today by describing a little bit of the story behind the U.S. Precision Medicine Initiative. I guess I could start off by saying that it didn't come out of left field. That indeed, I think there's a lot of foundational activities that took place that really set the stage for what is now happening in this arena of precision medicine, precision health, and so forth. Really, the starting line for this, I would contend, was the Human Genome Project, an effort I was involved in from beginning to end, starting as a postdoctoral fellow and as a resident in pathology, an exciting endeavor that began in 1990 with a series of goals. The most important one, of course, was to generate the complete sequence of the human genome for the first time. Keep in mind the relative youth of the field of genomics and the fact that it has only been a little over a quarter century since the Human Genome Project began. In fact, last year we commemorated the 25th anniversary of the launching of the Human Genome Project, and at that time I got together with my two predecessors as the director of the National Human Genome Research Institute, those two individuals being Jim Watson and Francis Collins, and we wrote this perspective piece in Nature that really spoke to the style of science as it has changed in biology, this big biology era. And we really emphasized in this perspective piece how the Genome Project not only delivered the sequence, the human genome, but really delivered some legacy components that are probably, in retrospect, probably as important. This embracing of big science, consortium-based science, embracing audaciousness. This will become important when we get to the Precision Medicine Initiative. Audaciousness of tackling big projects. The importance of sharing data and making data widely available to the international community. The emphasis on technology and the emphasis of thinking about the societal implications of these research accomplishments. And I think those are important things to keep in mind as a legacy for the Human Genome Project as we now look in our rear view mirror and think about the first quarter century or so of the field of genomics. In addition to these legacy elements, of course, there's been some incredible triumphs. I already alluded to one, the fact that we sequenced the human genome for the very first time as part of the Human Genome Project. We've gone on and now have reduced in a period of about a decade the cost for sequencing a human genome nearly a millionfold, almost being able to sequence a human genome for something like $1,000. And in fact, we're on pace to continue that kind of innovation to continually reduce the cost of sequencing genomes. Are getting a better and better interpretation of or a better feeling of the diversity that we see in our genome across the world's populations by now sequencing tens of thousands and actually close to hundreds of thousands of human genomes, giving us insights about the millions and millions of common variants in particular that exist in the world population, and having knowledge of where those variants are, what they are, and then being able to turn our attention to understanding the implications of those variants for health and disease. Because we can superimpose on top of that a profound advancing in our understanding about how the human genome actually works and how those variants influence genome function. But we've also been able to use these collective tools, technologies, understanding of variation, understanding of genome function, to now significantly advance our understanding of the genomic basis of human disease. We've gone from knowing maybe the genetic basis of something like 21 rare diseases when the Genome Project began, to now knowing over 4,500 rare diseases that we can point to the exact mutation or the gene that is mutated in those disorders. We've advanced substantially our understanding of the genomic basis of cancer. We'll be hearing more about that. And I think we've made significant progress in gaining a better foothold of understanding the genomic basis of common diseases, although clearly we have a long way to go on that. We've also begun to see the realization of genomic medicine, the actual use of genomic information as part of clinical care. That wasn't the case even 7 years ago when I became director of the Institute in a fashion that we see it now, particularly in cancer, particularly for rare diseases, particularly for prenatal genetic screening and diagnoses, and particularly increasingly in cancer and in pharmacogenomic arenas even beyond cancer. And so I think all of this sort of encapsulates this incredible momentum, this surge of advances we have seen in genomics in really its first quarter century as a discipline. Well, this attention has certainly been noted throughout the scientific community, but now I'm going to also be honest with you and tell you that the attention to genomics has also spilled over into the political climate as well. One of the individuals who has always been interested in genomics is this guy. I hope everybody knows this guy. Certainly in this city they should. He's going to be our president, I think, for about another 83 days or something like that, 84 days. But even before he became president, he actually was quite interested in genomics in particular. In fact, maybe you know this. I'm in Chicago. When he was your senator in 2006, he actually introduced this bill in the U.S. Senate entitled the Genomics and Personalized Medicine Act of 2006. It signaled his profound interest in this wave of advances taking place in genomics and genomic medicine. Turned out the bill didn't go very far in the U.S. Senate, but nonetheless, it symbolized his intense interest in the field. That continued as the president. He's always been he's surrounded himself by people who have kept him very updated on advances in genomics. And so actually a story began to unfold in about June of 2014. He actually convened in the Oval Office a small group of people that included the NIH director, Francis Collins, and some of his key science advisors, such as Eric Lander and others, and John Holdren, and basically asked the question of these people, is there something we could do big, probably in genomics, in the last couple of years of my presidency that could advance the field in a profound way? He apparently I was told he used the L word, the legacy word. He wanted to do something that he could have as part of his legacy. He also wanted something that he could probably get through the US Congress, and there were probably things that were not going to be feasible to get through the US Congress. At that meeting, he was convinced by the people that were there to recognize that he had heard a lot about genomics, but there was a lot of other advances that either were happening or were about to happen. And as we think about the major determinants of the most common diseases in particular that we are afflicted with, there is, of course, a genomic component, but there's components of lifestyle, environment, other aspects of our physiology, and so forth. And that he was most aware of genomic advances because of the technology surge that had happened over the past 10 years in particular. But that there was a comparable technology surge for monitoring environment and better monitoring our health that was likely we were on a cusp of. And as a result, he was actually convinced at that first meeting not to frame this around genomics exclusively, which would have been fine with me as the director of the Genomics Institute, but rightly so, to frame it in a slightly broader frame, one that embraced the G's, A's, T's, and C's of our genome as being important, but also recognizing that physiology, environment, lifestyle, social factors were important as well. Some of this was probably quickly influenced by the fact that around a few years before had been this major National Research Council report putting precision medicine very much in the forefront of people's thinking, with this report that really laid out the kinds of things that might be possible when thinking about precision medicine that included many factors that we can be precise about even beyond genomics. And of course, when you think about what precision medicine really is all about, it's just basically trying to do more precise accounting of individual variability. Genomics being the one we are so good at measuring now, but recognizing that we are going to see, and in the midst of a technological revolution that is going to see better and better means of measuring variability in physiology, better and better ability to measure variability in our lifestyle, how much we sleep, how much we exercise, things we're exposed to in our environment, and then things that sort of sit between lifestyle and environment, such as what we eat or what we do to our bodies. And these elements are all positioned to be able to collect data about throughout our lifetime, and perhaps there's new opportunities for research. And so you bundle all this together, and really what the president at the end of the day recognized was that what we do today in medical care is relatively imprecise, because much of what we do is based on the response of the average patient. But could we imagine a tomorrow where medical care would be based more on being able to look at and utilize information about differences among individuals, genomic differences, environmental differences, lifestyle differences, and have a more precise way to prevent and treat disease. And he wanted to launch something before the end of his presidency that would help us get from today to tomorrow. So that was June 2014. Francis Collins came back from that meeting, quickly assembled a group of people at the NIH, and it basically ruined most of our summers because we had other plans, but all of a sudden we had to spend most of the summer of 2014 coming up with a plan that was going to be back to the president in the fall. It was a great and exciting effort to try to come up with something that would be compelling. Lots of ideas were floated, many were discarded, and eventually, after a series and many, many meetings and many, many white papers, a plan emerged. That plan was brought back to the president in October of 2014. Shown here is a photograph from that actual meeting. And basically, the president gave a thumbs up. He loved the plan as it was laid out and said, let's build it in his next year's budget. And let's build in an organizational scheme that, if funded, we could be able to launch this before the end of his presidency. We heard throughout the rest of the fall and into about November, December that indeed he was fully going forward with this and would likely announce it in the State of the Union address in January of 2015. And indeed, that's precisely what he did. We had no idea actually what he was going to say, and what actually gets said in a State of the Union address is very much kept very confidential until the president speaks the words. So we all gathered and waited to see exactly what he would say about this initiative in the State of the Union address. And for those who haven't seen it, let me just remind you what he said.
21st century businesses will rely on American science and technology, research and development. I want the country that eliminated polio and mapped the human genome to lead a new era of medicine, one that delivers the right treatment at the right time. In some patients with cystic fibrosis, this approach has reversed a disease once thought unstoppable. So tonight I'm launching a new precision medicine initiative to bring us closer to curing diseases like cancer and diabetes, and to give all of us access to the personalized information we need to keep ourselves and our families healthier. We can do this.
So three things from this clip. First of all, number one, when the President of the United States actually mentions a field of science that you've been involved in, like genomics, for your entire professional career, that's like way cool. So that was a great moment as far as I was concerned. Second of all, we didn't know this thing was going to be called the Precision Medicine Initiative until he said it then. And once he said it, that's the name, and he's the president. So that's how the name came to be, because that's what he used, Precision Medicine Initiative. Number three, I watched the whole State of the Union address because I'm sort of a political geek. And I can tell you that it was the only time all night Biden and Boehner both stood up and clapped at the same time. The rest of the State of the Union, they never were synchronous. It was also the only time all night both sides of the aisle stood up. And that signaled what was anticipated, which was going to be bipartisan support for that. That bipartisan support indeed has manifested, which is why this initiative is taking place. So we got the funds to move it forward. So that was the State of the Union address. 10 days later, in a formal ceremony at the White House, the president gave many more details and laid out in a very wonderful ceremony some of the details about the Precision Medicine Initiative. And that's a photograph and a quote from that event. Perfectly timed to the president's announcement on January 30th of 2015 was this, still really the only formal publication coming out of NIH at least, about the Precision Medicine Initiative. It went online precisely when the president was speaking. And if you haven't read this piece by Francis Collins and Harold Varmus, then director of the NCI, I would encourage you to do this. It details sort of the multiple elements associated with the Precision Medicine Initiative, which includes a major cancer genomics component, some issues to change with respect to FDA oversight of genomics. And I'm not going to talk about those things and even a couple other elements. What I'm going to emphasize, because it's relevant to what's going on in particular here in Chicago, is the centerpiece of this initiative, which is the creation of this U.S. National Research Cohort. This indeed is an audacious effort, although it's not that we're the first in the world to do this. In fact, the US is slightly behind in launching such an initiative, but this one's going to be, of course, bigger and bolder in the great American way. This is going to be aimed at least 1 million. I predict it'll be more than 1 million individuals, and when they volunteer to participate, they will share a lot of information about themselves: genomic data, lifestyle information, biological samples. All of this will be linked to their electronic health records. The idea is to share the data broadly but safely. The idea is to make this be an adventure that is going to allow for open, responsible data sharing, but of course building in a lot of strong privacy protections as well. One could imagine with the kind of data that's going to be collected for 1 million or more Americans, and having that data available for research, it gives you a platform for studies aiming to do a variety of things in ways we've simply have never had the power to do before. And it will, I think, surge forward some opportunities in ways that we couldn't have even imagined 5 and 10 years ago. It will be a longitudinal study. It doesn't have a precise ending date, but one could imagine if this is going to be successful, it's going to go on for a decade or 2 or 3 or 4. Now, why did this, when we worked most of the summer of 2014, why did we come up with this kind of a program? What was the timing element that, because ideas like this had been floated in the US earlier and really hadn't got much momentum or many roots. I think this was an example of just having the timing be really appropriately right to do it, especially the way it's being done. There are really a number of elements. We heard from an earlier speaker what some of these key elements are, but let me just give you my spin and my flavor for how I think the packaging of this becomes so important. You know, one key element, obviously, is genomics, and that's probably the one that needs the least introduction. I gave you an overview of this. The advances have been spectacular, but it's not just the simple advances of sequencing the genome, having better technologies, better understanding about how the genome works. It really has been also by a surge we have seen in advances in understanding the applications of genomics to the practice of medicine. I'm very proud of the portfolio we've put together, and particularly over the last 7 years since I've been director in genomic medicine, and a number of initiatives I think that have really given us some very important foundation for how genomics will be applied medically, and now seeing that as almost preliminary efforts that I think can be very much, will inform what's going to happen in the Precision Medicine Initiative. One of many examples I could give you, but one that is very relevant to the Precision Medicine Initiative, is trying to get to the point where we have a better clinical knowledge of what to do with genomic variants. We have a tremendous amount of data about genomic variants and a tremendous amount of scientific data to say what they might be doing biologically. But what you do clinically with that knowledge is certainly not an easy thing for a busy healthcare professional to quickly glean. We need to close that gap so that busy pharmacists, physicians, nurses, physician's assistants, and so forth can look up very quickly when they encounter a genomic variant in a patient and know what to do clinically with that information. And we are so far from being there. It's something that requires a significant research effort. This is a research effort we put together and have now launched several years ago called the Clinical Genome Resource. And I predict this and similar efforts going on around the world are going to be the kinds of things that will be catalyzing advances within the Precision Medicine Initiative to really see genomics become applicable in a clinical setting. But believe me, it's not all about genomics. I would contend that what we are seeing now with a greater number of individuals having their clinical data captured by electronic health records is going to put us in a situation to have research done in a way that simply wasn't possible 10 years ago. You know, 10, 12 years ago, only about 15 to 20% of healthcare delivery systems in the United States had electronic health records. As you probably all know, that has surged. It is now well over 90% of healthcare delivery systems have electronic health record systems in place. A lot of that data just sits there, and it's mostly around dealing with billing and dealing with a lot of things with the clinical workflow. It is not about research, but that data can be used for research. And indeed, we want to see that data used for research. A program we've had going and we've been directing since 2007 has taught us, and this is a program called Emerge, has taught us that with electronic health records and with genomic data and with biospecimens, you can do a tremendous amount of discovery research about the underlying basis of disease. You could even start to do implementation research with that. And I think in many ways, Emerge has taught us some very important lessons that I think will very much be helpful as we stand up the Precision Medicine Initiative. Even going beyond that, the reason why this isn't all about genomics is because of the technology surge I mentioned earlier, related to our ability to better measure our physiology, better measure environment, lifestyle, and so forth. It is, really remarkable what is happening in this space, much of it in the private sector, some in the academic setting as well, but I really think we're going to see a remarkable surge in the coming years. Whether it is for measuring blood analytes or better for measuring other aspects of our physiology. We have become enamored, with our Fitbit-like devices that many of us wear for recreational purposes. But, these Fitbit things really are hardly clinical grade, but clinical grade stuff absolutely is arriving on the scene, and one could readily imagine harnessing these devices, these mobile health devices, into these volunteers in the initiative and capturing large amounts of data that would be far more accurate than the kind of data that often is acquired in a single clinical visit once every few years. And of course, it's not just going to be these devices that we wear, it's also going to be the fact that these devices will be communicating with other devices. And believe me, these smartphones that were hardly on the scene 10 years ago have seen a 160-fold increase in usage in the United States in the past 10 years, are going to be transmitters of this data, are going to be containing a lot of information about our health, and are going to be ways that individuals participating in the Precision Medicine Initiative will be engaged with the initiative through these kinds of devices that really are sort of changing our lives in many, many ways. And you can certainly see the private sector getting very involved in making our iPhones very relevant to our health and making these smartphone devices sort of something that's going to capture data, transmit data, and so forth. But of course, with a lot of genomic data, a lot of electronic health record data, a lot of mobile health and smartphone data, boy, are we going to have this be a data-intensive enterprise. And I do believe that data science is going to be a key component of this, as it should be. In fact, I would contend that we are seeing a seismic shift in what we do in biomedical research, not just in genomics, but all aspects of biomedical research, which really is catapulting us into sort of an era of big data. This is chronicled in the journals all the time. Many, many institutions are trying to figure out how to deal with this rapidly changing landscape where data and data analysis and data science is the prominent thing that many people do now in biomedical research. I can certainly tell you that NIH, we are scrambling to figure out how to better organize ourselves as a funding agency, one where there isn't a single focus of one institute or one center responsible for all of data science and biomedical research, and yet we know this is going to be one of the most limiting things if we don't figure out a better way to develop a stronger workforce, a stronger infrastructure for doing data science. I think Precision Medicine Initiative will be another example of something that'll sort of motivate us and catalyze us to surge forward. And the fifth thing that is worth mentioning that I think will be different about this project compared to other projects done other parts of the world and other similar projects that may have been done in a cohort-organized fashion in the United States is the engagement of the participants, not as subjects, not as patients, but as true partners. From the very beginning of planning, it was recognized that it was key that the participants would be part of the organization, part of the strategic visioning, and be heavily engaged in the process. And so I think the idea of using social media and citizen science efforts and really recognizing that individuals want to participate in these kind of endeavors as long as they know what's happening to their data, as long as they get input into how the data is used and what some of the framework is for organizing the project, it becomes a very synergistic and very positive enterprise. And I think many of the stylistic things with which this project is going to be conducted are going to be with the participants in mind as partners with the scientists. Well, standing this up very quickly over the past 18 months or something like that has been challenging, but at the same time, we, I think at NIH, worked very hard to make this as transparent as possible. There's a lot of interest in this, and we want there to be a lot of interest and a lot of enthusiasm, and we wanted it to be very transparent. If you have not visited this website, I would encourage you to do so and hopefully do so for the next 20, 30 years. Hopefully this will be the landing page for the Precision Medicine Initiative at NIH. And we have put lots and lots and lots there, whether it's white papers, whether it's workshops or videos of workshops, and obviously everything about funding announcements, but it's the place that people will gather to see all the information available about the initiative. Among the many things, of course, that you can find there are just very practical things as they sort of come online. For example, when there was actually an external group that got together and now over a year ago, delivered essentially a white paper, or if you will, a strategic plan for how the cohort program was going to be put together. Immediately that went up, and if you want to see the blueprint for the cohort program, this is the strategic plan you should look at. To do this is going to require great leadership at NIH. It's going to involve lots of people. Almost an army of people will eventually be needed, and lots of individuals among the institutes, but also people who are dedicated to just building up this cohort and overseeing it. We're very fortunate to have recruited Eric Dishman, who is now the director of this cohort program. He came from the private sector. He has a very compelling personal story related to precision medicine. If you don't know, you may want to go read about. But he has been very active in leading the team to stand this up. And of course, the reason Eric and all the rest of us are busy just standing this up is that we have 84 or 83 more days. The idea is, if possible, to try to get this thing launched before President Obama leaves office. To do that, we did get a nice bolus of money last fiscal year to get the first sets of grants out, and this institution being one of the beneficiaries of that. And to sprinting to the launch, it may seem that we are having breaking news about this very frequently, and that's probably true because there's a lot happening to get this thing stood up as quick as we're trying to get it stood up. Back earlier in the summer, in July, we announced a series of awards. Even earlier in the year, we had announced some other components being funded. But this was a big announcement that came out in July. But really to signal his continued interest, and believe me, he is continually interested in this. The president, the day after this announcement, published this op-ed piece in the Boston Globe that really once again emphasized his excitement about this and his view of how important this is for the future of medicine. Just a couple of weeks ago, there was yet another set of announcements, some additional centers that were funded to have intake of participants into the cohort program. And as you heard mentioned earlier, also came an official renaming of the cohort program, because cohort is a word that oftentimes is not completely understood, at least by the general public. The idea was to come up with a better name that was a little catchier, and so this idea of all of us being the official name for the cohort program was announced a couple weeks ago. And so off we go. I'm not going to go through the details of all the different components, whether it's the biobanks or it's the medical centers or the health centers or the DNA or the data acquisition centers or the biospecimen collection components, et cetera, et cetera. You could imagine if you're going to quickly, over the next few years, recruit 1 million or more people, you need a whole network of experts. And I think we've begun to assemble such an impressive network with many components. And also will involve a tremendous effort of engagement of the U.S. population to be aware of this, including those people that are going to agree to sign up and go to sites like joinallofus.org to find out how they can participate. So that's the story up until now, and now we're going to all put on our seatbelts and watch this thing take off as we begin to enroll individuals, build up this data resource, and then, of course, build research projects on this foundational data resource to see what we can learn with that kind of data. In closing, I do want to make one last point, because I think it's an important point to make. Over the last year, and I predict over the next year, maybe even over the next few years, there will be many points in time where there will be uncertainty of exactly what we are doing, how we're doing it. And in fact, if some of you'd come talk to me at the break, you may ask me a question and I may say, I don't know. How are you going to do this? We don't know yet. How are you going to do that? Not sure. We'll figure that out later. And sometimes people are taken aback by that uncertainty. So in the face of audacity of this big project, there's a lot we simply don't know. And what I want to do is assure you that that is okay. There's a historic irony, and I'm reminded by this, and maybe it just relates to the fact that I remember so vividly 25 years ago, almost precisely, or 26 years ago, we had just finished that first year of the Human Genome Project. I was there on the front line, toiling away, just figuring out how to map the human genome. If you would have come up to me 25 years ago and said, how exactly are you going to map and sequence the human genome? 1991, I would have said, we don't know. Haven't figured it out. We'll get there, but I don't know. And you might have said, wow, that's really odd. I mean, here you have this big audacious project, you're going to get this goal done, and yet you honestly don't know. And that's okay. I actually think the same thing is true with the precision medicine. There is a lot we simply don't know, but we're going to put together this incredible network of people, and we're going to figure it out as we go along, and we will be willing to rip up ideas we had and come up with new ones. That is exactly the way the Human Genome Project was done. There were lots of ideas that were tried and then discarded. We kept an audacious goal in mind and figured we were going to get there with the creative energies of the network of scientists involved. But at any moment in time, there was a lot of uncertainty, and that sort of kept us in a healthy edginess kind of way to sort of not be conservative, but to really push the envelope. I think that same kind of audacity and willingness to embrace change will be a key component of the Precision Medicine Initiative. And the reason I firmly believe that is a reminder that, you know, all this is research. We don't have this precisely mapped out. The Human Genome Project was a research endeavor. Precision Medicine Initiative is a research endeavor. And in my office at NIH, literally above the door inside my office, I keep this little placard because I really do believe in it. It's a quote by Albert Einstein. It says, if we knew what we were doing, it wouldn't be called research. And at the end of the day, we should keep in mind that all these aspects of the Precision Medicine Initiative and all these initiatives in precision health are research efforts. And as a result, we don't know precisely what we're doing, and that's actually what makes them so exciting and so motivating to the participants. So I will stop there. I will happily talk to people at the break. I look forward to the speakers that are going to follow me. Thank you very much.